YouTube, how you guys doing? Okay, so today's video is gonna be on elopement. It is not a fun topic, and it's not something you ever want to go through at work. Okay, an elopement is like if a patient gets out of the facility, or like, I'm not sure about the exact definition. I'll put it in the description box. But like, if it's not a designated time and they make it out the front door and nobody knows, it's basically like an elopement. You know when it happens that it's an elopement. So there can be a witness one where a patient is trying to leave the facility and you can't control them. So you have to, it's like common sense in that situation. Like, you have to stay with the patient and make sure they don't like continue to leave. If you have your cell phone, call the facility, get in touch with somebody inside the building. Yell for help. You might leave like a couple feet just to get within earshot of somebody to get help. But basically, stay with the patient and make sure they're safe. That's basically a witnessed elopement. And then you would go, talk to your unit manager or whatever, figure out what you have to do next. It's an incident report. The person has to be on report, and has to be and then there has to be some kind of an assessment done in the computer regarding their change in status. Like, now this is a patient who's an elopement risk. Any patient coming into your facility, you should be assessing them for an elopement risk. There should be a form in the computer. If there's not, that is just something I'm not familiar with at my facility. Like, we have to do an elopement evaluation, and it's designed by people higher up in the company. Like, so it'll ask you questions and it'll give you a score based on your answers to the question. So if they're an elopement risk, then they should have some kind of measures in place, should be care plan, blah blah blah. That's basically for the unit manager. All you have to worry about is make sure your facility is doing that. If it's not doing it, then it's bad practice. Like, all patients should be evaluated. So make sure that when your admissions are coming in, that there's an evaluation done on that, so you're covered. So you don't have patients under you who are at risk for an elopement and you don't really know as a new nurse. So make sure you know who your elopement risks are. They should have a wander guard or something. On orientation, make sure keep this in mind, like who's walking around, who's oriented, because pre-pandemic, like, the patients are just like going all through the facility. They might go from floor to floor, they might go to activities, they might go to physical therapy, they might go to the front desk, and they might go outside and sit. Now, an alert oriented ×3 patient could jump in a car very easily and jump in the car, have the person throw their wheelchair in the back or the walker in the back, in the trunk, and they could be out as faster than you know. So when you come on your shift, I've said this several times, like, do your rounds. If you have a bed and there's no patient in that room and in that bed, know where that patient is. Put a dot next to their name and track them down. If they're in physical therapy, you need to know they're in physical therapy. If they're in activities, you need to know they're in activities. This is for like 3 to 11, especially because that's like midday when patients are here and there and there, and, everywhere. They could be on an LOA. They could be at a doctor's appointment. know where your patients are when you come on your shift. So that's when an elopement happens. It happens when you're unaware. Like, you got patients going up and down. Like, you need to do a walkthrough. Like, just always be thinking, where's my patients? I'm not seeing them in their bed, and keep an eye out for them. And if a couple minutes goes by and it's like, yeah, I still haven't seen this patient, and you're mid-shift, like, give therapy a call. Hey, you got so-and-so? Give activities a call. Hey, you got so-and-so with you? Call the front desk. Hey, you see so-and-so in the lobby? Like, be aware of where your patients are, okay? Who's the patients who's gonna elope? The patients that are gonna elope, like I said, is the alert random time story patients. The other patient type who's gonna elope is the patient who's confused, who's trying to go to work, who's trying to get on the bus. You know what I mean? Those patients, like, oh, I gotta go to work. And they're just like a dementia patient at a nursing home. They don't have to go to work, but they're the ones that are gonna look for the exit. And they're just gonna be walking around, all right? Trying to get out. Like, that's their mission. Those patients are gonna elope. So this is why you need to do your rounds. This is why you need to keep an eye on where are my patients. Like, when you're doing your bed pass and you pass by an empty bed, keep that in mind. Like, just always be thinking about that, okay? And like I said, this elopement risk is evaluated on admission, and it's done quarterly in my job. I don't know if it's the same everywhere, but that's how it's done in my job. So if all of a sudden you cannot or you come in on 3 to 11, you're doing your rounds, you can't find the patient, you call physical therapy, you check to see if they're on a doctor's appointment, you check to see if they're in the lobby, you call activities, they're not in activities, they're not. And at this point, you have no idea where they are. This is when you get on the phone, you get on the overhead pager, and you say code whatever. Like, say there's a fire, you say code red. Figure out in your facility what's the code for an elopement, because at that point, it's a building-wide effort to find this patient. You say code, let's just call code blue. Code blue, 3rd floor. Code blue, 2nd floor. Code blue, whatever. And you tell your unit manager either before you page or right after you page, and you say, we need to find so-and-so. At that point, everybody should be dropping what they're doing and go room to room. You check the bathroom, you check the closets. Maintenance, they're checking their closet, their office. Everybody, CRC, the DON, the administrator, everybody drops what they are doing and goes room to room. You are checking closets, you are checking walk-in fridges, you are checking every corner, under the beds, you're checking everywhere for this patient. If you cannot find this patient, basically this whole time you're communicating with your unit manager, you're communicating with your supervisor. At this point, the supervisor is in communication with the DON, and the supervisor is in communication with the administrator. If it's after hours, like after 5 p.m., everybody's home, that supervisor is calling the DON, that supervisor is calling the administrator, and those two are coming to the facility. So you do not want to be in an elopement, okay? You do not want to go through this. So basically, everybody's looking for this patient. If you cannot find this patient. Nobody in the building, all the staff cannot find this patient. You're looking around the perimeter, you're looking around the property, like right in the immediate vicinity of the property, you still can't find this patient. And you know they're not on the LOA, you know they're not on doctors, you know they're not anywhere, then the police are contacted. And once it gets to the point, it's like, we don't think the person is in there, in this facility, then somebody has to hop in their car and somebody has to start driving around the streets around the property. Like, you might go up this street and see if they're walking. You might go up this street to see if they're walking, especially a confused patient who's only gonna be on foot. And of course, you do have crazy family members that might come and just take the patient without telling you too. So confused patient there is a possibility that the confused patient isn't going to be on foot, but still you have to keep looking. And it comes a point where it's in the police hands and there's nothing we can do. And so basically, up until now, the nurse has to look for the patient. The nurse has to tell the supervisor. But beyond that, there's nothing the nurse has to do until we come to a conclusion that you can't find the patient, and then an incident. And then after everything, like, figured out, like, we don't know where this patient is or we found the patient, then the incident report has to be done. And the nurse has to do the incident report unless you have a supervisor who's gonna do it for you. You have to say when's the last time you saw it and do the form in the computer, which will ask you for all the information you need to put down. That's how it is in my job anyway. You click the topic, and then once you block that, once you put in a certain thing, it automatically goes to corporate, or it automatically goes to so-and-so. So once you put in a certain topic, then it's basically automatic. That's in my job anyway. But the administrator would already have been in communication with, and the DON would already have been in communication with the next person up who needs to know about this. And I'm sure it's reportable to the Department of Health, and they'll come out and investigate and all that stuff. So, but that's what happens in an elopement. And the DON is calling the family, the unit manager is calling the family. You are not calling the family. And that's how it is in my job anyway. And this is from corporate. It's not just like what my unit manager told me. This is from corporate. Like, the DON is calling the family. Like, it's that serious. Like, it's handled way different than, let's say, a fall or a skin tear. It's not a regular incident report. Basically, it's like the worst thing that could happen. One of the worst things that could happen to you. So avoid it and know where your patients are. Do your rounds. Okay. That's basically it on this topic. Yeah, I basically covered everything. So if you have any questions, let me know. If you want to see anything else covered, let me know. If you like it, hit a like. And that's it. I'll talk to you guys soon. Bye.